Here we go.
Looks
All right,
good.
guys. So I put that together. One of the biggest things I think that I face a lot of times is really emphasizing how important it is to get food allergies and sensitivities under control because it's all connected to a bigger picture called whole body health. And whether you talk about cardiovascular issues, thyroid issues, all the obvious gut immune issues of autoimmunity when zonulin's high and when you're creating too many inflammatory cytokines affects the insulin receptor. What I wanted to do was tie all that together today for you so you understand why the gut's at the center of it and why if you don't understand what people are reacting to, how you're really just kind of creating a low grade burn in their immune system that's moving them down a path towards chronic metabolic dysfunction. So I hope that this discussion isn't too chaotic because I'm going to cover a lot of terrain in a very short period of time. So let's roll. So what I thought I would do is say, let's start with the end in mind, right? Because first of all, number one killer in the United States is still heart disease, guys. But if you notice, if you look to the far left, you notice that high fat diet, gut microbiota dysbiosis, the first step is I'm eating a diet, whether it's high fat or too high in sugar, too many refined carbs, whatever, reacting to foods, we create a problem with dysbiosis. So now you got bad bugs, or you've got bugs that are dying off. That creates a change in permeability of the intestine, which then leads to metabolic endotoxemia, meaning an increase in lipopolysaccharide. And we're going to circle back to all this. This is like the opening story. And then we're going to backfill all this stuff. That metabolic endotoxemia leads to low grade inflammation, elevations in C reactive protein, insulin resistance, elevated HOMA-IR, elevated fasting insulin, maybe postprandial glucose oscillations that are too big, which then leads, of course, to obesity and diabetes and other metabolic disorders, neurodegenerative disorders included. And then also you see the drop down where it leads to reactivity, tissues and autoimmune reactivity, which ends up with vascular immune dysfunction and end organ damage, principally plaquing your arteries. And at the same time that's going on, there's this imbalance in the central nervous system where we get the upregulation of the sympathetic nervous system that gets activated. We now are communicating through the enteric nervous system, which is altering intestinal motility, altering visceral sensation. And this is the track that most people go down. And you may not have irritable bowel, but you could be clogging those arteries and creating arterial plaquing and having a gut that's creating a tremendous amount of immune dysregulation without it being, the obvious, I've got a gluten intolerance and that's why it led to my MS. You guys have heard that, but I want to expand your concept of thinking about this is every aspect of what's going on with the people that you see every day. And this is the setting our purpose of beginning with the end in mind. The first piece is, or how do you get the gut to get thrown off anyway? So as we move into allergies to start this discussion, poor inflammatory dietary choices, lots of stressors like emotional stress, right? Anxiety, depression, PTSD, perseveration, right? Infections, biotoxin exposure, lectins. It could be an illness that you have. Low stomach acid, right? You might not chew your food thoroughly. You don't release stomach acid. Maybe you're wearing out your pancreatic enzymes because you eat too much, you eat too often, and you eat too late. And then toxin exposure plays a role. And all of that ends up leading to altered intestinal permeability, which then leads to food allergies and sensitivities, malnutrition because of malabsorption, dysbiosis, unfriendly flora growing in the gut, then or even pathogens, right? Or toxin overload. So either metabolic intermediates that create toxins from metabolic intermediates, improper metabolic byproducts. So instead of making serotonin and dopamine, you're making kenurinic acid, salsolinol, and quinolinic acids, right? So you're getting depressed, getting mood changes because of improper pathways because of the inflammatory signaling. But in the end, it leads to elevated total toxin and antigen burden. And that's going to be what leads to chronic disease. So the very outset, you can't escape the fact that everyone is in this process to some extent. And just to go back another step, there's food sensitivities and food allergies. Obviously, when you have a food allergy, it's histaminic, it's life threatening, it's anaphylactic. Reactions can happen relatively quickly. And obviously, the common nut, peanuts, so legumes, tree nuts, eggs, milk, fish, shellfish, could be food additives, it could be a medication, stinging insect. That's classic for food allergies, IgE. And then there's food sensitivities, which is the reactions are slower, sometimes up to 72 hours. It's typically not life threatening, but it can make your life miserable, foggy headed, itchiness, maybe a little bit of skin reactivity, but it's not to the point of it's a full blown skin wheel. It could be joint aches, muscle soreness, right? Any number of things can happen with food sensitivity. And how does it begin? Of course, it begins because of the gut permeability. So if you go back to the very beginning, my first two slides, we talked about gut permeability being an issue. And that gut permeability can be driven by a lot of different things. But once we break those tight junctions, and then the allergen or the peptide from a food or whatever it is that's getting presented in the bloodstream, it gets through the epithelial tissue. It gets presented to the antigen presenting cells with the eventual creation of an epitope. Now, the epitope in this example could be IgE, it could be IgG4, but in the end, we create these epitopes. And so that at one point, even though you were good with peanut butter when you were a little kid, your gut's gotten permeable, and now you're 35 years old, you ate some peanut butter and you went into anaphylaxis, right? And of course, everybody's got mast cell cytosis now. We're all in all of a sudden everybody has it. No, all of a sudden everybody doesn't have it. Everybody is gut is breaking down for a variety of reasons, biotoxin exposure, toxic metals, drug therapies. But the bottom line is we start to create this type of behavior where we create epitopes. And remember, this starts early in life. 35 years ago, when I was in my first 5 years of practice, I didn't see a bunch of children with eosinophilic esophagitis. And now we got whole hospital wings devoted to EOE. Children's Hospital Cincinnati, one of the leading centers in the country, doing that kind of research. But the bottom line is we're still putting band-aids on bullet holes. We got to get back to repairing the gut and retraining the immune system, right? And when you look at this, altered microbiota can occur while they're neonates. So we have more and more children with issues gastrointestinally as they are just born as infants. And then this just progresses through their adult life with that old story. It can be ear infections, allergies, asthma, and then autoimmunity. That's the progression. So unless we intervene and understand how to correct for this, it doesn't matter where you enter that funnel. You may not start having allergies until you're 30 years old, but you can start guiding yourself towards autoimmunity or neurodegenerative disorders or cardiometabolic disorders. All of it's a reflection of that inflammatory signaling that's going on. And quickly, of course, IgE went through, but this is the classic allergy. And then you could have a sensitivity. And a lot of people say, oh, IG don't matter. I don't agree with that. Yes, it's true that IGs are immediate because you're eating foods all the time. But if you're having really high excessive IG responses, it's still triggering your immune system. Why is it that some people have super high IgGs and other people don't? Typically because one person's guts broke down, the other one isn't, and they're eating the same food every day, right? It still can drive a bit of a histaminic response. It's a lower grade chronic inflammatory response. Obviously, you've seen this when you've taken people off of simple IgG finger sticks, although it's a very incomplete test. But it's important to note that all of these reactions, looking at, for example, IgG4, I look at these all the time because IgG4 is the epitope that actually expresses itself to prevent IgE. So it blocks IgE. So the higher the IgG4, the more we're creating an inflammatory response, and it's associated with autoimmunity. So IgG4's got some great value. 15 years ago, you read about IgG4 and people were like, "Yeah, no big deal." But now the literature's pretty clear that it does contribute to immune burden. And of course, C3BD, or the complement to IgG response in the body, that drives the reactivity up 10,000 fold because it starts driving pro-inflammatory processes. I can just tell you when people got COVID infections, we could see that during COVID, a lot more complement pathway activation was occurring, and that was a feature that was seen in the pandemic. And I think what we're still seeing play out post pandemic, post vax in a subset of people, depending on where their immune system was when they either got exposed or got the jab. Conditions that are associated with IgG4, obviously, I've just listed some of the ones that are in the literature, and so it's come of time now that we have to recognize that IgG4 is real. And it's an indicator of allergen exposure, and it also decreases false positives. So if you have IgG4, it's something you want to pay attention to. I typically make sure I'm getting people to avoid IgG4s, especially if they're circling around autoimmunity or they already are autoimmune. And it just helps you to really understand the severity of what's going on with their reactivity. And then, of course, when you think of this C3BD reaction, this is where the complement immune system gets upregulated. So if you're reading a lot about biotoxin exposure, you're seeing, a lot about this complement pathway being activated. TGF beta 1, looking at metalloproteinases, VEGF, anticardiolipin antibodies, any number of melanocyte stimulating hormone, right? All these different things we look at when the complement system has been disrupted. You can see a feature of that is, hey, look, I probably need to test for foods just to take the extra immune burden off the individual, right? It's not that it's curing it in that situation, right? You still got to clean up whatever it is the biotoxin exposure is, but anything you can do to reduce immune burden helps you to work at that root cause issue a little bit better. And so by measuring complements that bind to IgG, you're more likely to find the most inflammatory IgG titers. Now, usually I only find one or two of these in people, but more frequently post pandemic, I got people with 6 or 8 of these. Where they really are loading up that complement pathway. If you look at this, if you look at the top, you see this danger sensing. This is where we get those damage associated molecular patterns that are going on, where we're triggering this C1q pathway, which is the pathway that when you did get COVID, you got SARS-CoV-2. That pathway is the pathway that got activated, which leads to activation of the C3 pathway, then the expression of C3BD, C3A, C3D, which all is loading into activating those complement receptors and driving that background of immune activation. And I just put this in here just for you to realize that if your HLA gene SNPs, which of course the biotoxin folks are up on this because they know if you're HLA positive, you're more sensitive to these gene SNPs, but that your gut is protecting this process, but the issue is the more ground state inflammatory process you have going on. So it doesn't matter whether it's stress that's triggering your interleukin 6, overtraining, it could be exposure, it could be lack of sleep, it could be any number of things. It could be a food intolerance, right? But anything that's going to lead you down this path of monocyte activation to M2 macrophages, you can see the net result here. Increased eosinophils, increased histamine, and increased mast cell activation. So while we talk about the mastocytosis, what's really going on is we're just seeing a big expression of this because of exposures from individuals, and they're getting multiple exposures. Their guts get impermeable. They have HLA gene steps. They're getting exposed to a mold or a tick bite. At the same time, they're eating foods that are triggering their epithelial cells to react, right? So all of this is piling in on the immune system. And that's why it's so important to identify baseline taste, because the one thing you do every day is you eat. And so why not look for foods that are going to be efficient at keeping your immune system from heating up. This is what the panel looks like. I just want to get through this so you see this at the outset. So look at beans and legumes on peanuts on this individual. They're red hot for IgE, IgG4, and IgG. So this is a pretty hot area for them. And so if you look here, if you look under dairy, you're seeing over here that the complement path has also been activated. So this creates a 10,000-fold increase in immune activation. So it gets much more sensitive to in this case, the dairy, and triggers a much more in-depth reaction. Just seeing it's very clear and easy to read this. And obviously, if you have IgEs, people should avoid them. And if they have IgG4s, I'm big on that. Sometimes if somebody's barely over the edge, like here, for example, hazelnut, 2.87 on a 2.5, I may tell them, look, have hazelnuts once a week. It's not going to kill you. It just depends how immunoreactive they are. If they're fighting a big autoimmune disorder, I'd say get off of all the yellows and reds. Once again, when I see people reacting to aspergillus, I have them do a visual contrast screen. I want to see, are you moldy or not? What's going on there? But this basically really lays out clearly where you're reactive, and the accuracy on this. The lab director for Infinite is just incredibly experienced. And Dr. Tata also does monthly checks for reproducibility, which a lot of labs only do quarterly. It's one of the reasons I talk for Infinite, is that I really the thoroughness of reproducibility and accuracy that they look for. And now they have a finger stick that you can also do that goes through that same process and even compares it to a venipuncture in terms of getting their accuracy together. So this allows for a very nice, elegant report, easy for the patient to understand. And then it creates a list for less severe. So if you see over here on the left, for patients with less severe symptoms recommended with high reactions of 4 markers measured or eliminated from the diet. All right. So this is the highest, only get rid of the highest reactors. Hey, I'm interested in weight loss. I don't want to go crazy here, but I'd love to know what my food allergies are. Or if you have someone who's really challenged, it gives you a more thorough reaction list that you would follow. It gives you a quick down and dirty at the end. Here's what you should do. And you can make that determination if you want to say, hey, follow the less severe symptom list or follow the more severe list. I typically, depends how big that severe list is. If it's really big, I'll actually go through it and look and see how close they are on some of the yellows in IgG. If they're IgG4 or C3BD, I'm less tolerant of allowances on that. So what creates this immune dysregulation? So why do we start to get sensitive to food? Why do we get allergic to food? Obviously, medication, stress, diet, alcohol, exercise, a big one. I've got a slide in here showing you that. And I did a whole talk on exercising gut that's on Rupa. So please follow back on the several talks we've done in specific areas. Environmental triggers, chemicals, obviously, and then of course pathogens, all of them lead to things like autoimmunity, heart disease, obesity, metabolic syndrome, diabetes, mood disorders. It's far reaching, right? Obviously, malnutrition. And here are all the drugs that are induce microbiome disruption. These are drugs that people are on every day, guys. So if you have people coming in that are on these kind of drug therapies, you got to think, maybe I should test for food. Are they exhibiting any symptoms? Did I look at their lab and see, wow, their CRP slightly elevated, their mean platelet volume's elevated, they got a little bit of homocysteine, their glucose is in the 90s, right? 9 points for every point above 90 is the latest study for 10-year risk of diabetes. Now, where's their insulin at? Where's their kidney function at? Was the pH of their urine low? What would make me think that they've got a meta-inflammatory event? And remember, it's the interface of the gut and the outside world that is triggering a lot of this. And of course, the first thing that happens, I just want to quickly do this. All of us know about Candida and hey, you got thrush on your tongue. I want to clean up your Candida. You're gassy, you're bloated, you're tired after you eat, you get foggy headed. And obviously, the next step is that byproducts of Candida metabolism are mycotoxins, and mycotoxins damage intestinal cells. They interfere with thyroid hormone. They interfere with the insulin receptor. They damage the beta cells of the islets for the pancreas. And so you create a lot of acetaldehyde when you're yeasty. And a lot of times people don't appreciate this enough. So acetaldehyde is a byproduct of yeast production. And so it has to be broken down in the body by aldehyde dehydrogenase. If the enzymes can't keep up, the acetaldehyde accumulates. And when the acetaldehyde is depleted, and you have to look because it depletes vitamin B1 and B3, you need molybdenum in this situation as well. So when you can't keep up, it reacts with dopamine to make a compound called salsolinol and reacts with serotonin to make beta carbolene. So you no longer have serotonin and dopamine. Instead, you have phenols, and that is what leads to mood disorders. It's also why you get a lot of younger children who get really dopey when they eat certain foods because they aren't making serotonin and dopamine. Instead, they're making phenols, which make them more reactive, as seen in spectrum disorder situations with high phenolic foods, right? And it can lead to feed addiction profiles because you don't make enough dopamine. You're going to be triggering that reward cascade if you're predisposed. This was a 2022 publication, The Side Effects of Acetaldehyde Production. It stops neurotransmitter production, leads to mood disorders, creates cell damage, creates foggy headedness, headaches, chemical sensitivities. So if you do not have an integrous gut and you're not reducing inflammation and you're not if you're loading up a bunch of sugar and carbs, you're going to grow yeast. Yeast is going to off-put acetaldehyde, and you're going to end up in these situations, which we see all the time. But I think a lot of people forget, gee, what's behind the curtain on that when it's acetaldehyde. And how do you clean that up? Pretty straightforward. On the molybdenum, get the B vitamins on board, but mostly it's kill off the yeast and get the liver being able to appropriately convert the acetaldehyde to acetic acid. And remember, you've got this gut immune brain connection. So the talk today was about immunity. And I took it in the broadest sense, meaning that your brain's primary command and control. And when you think of gut immune brain, that's where we filter, we defend, and we repair our tissues. We take in nutrients in order to repair and refill our certain aspects of our nutrient needs in our body because they're being used up every day in our metabolism. Of course, sleep regulation, memory, inflammation. But the big thing is that when it's normal, you feel good. Think about it. People that come into you and say, yeah, I poop once a day. I got no problems with it. It's regular. And I'm not saying that's the only thing about the gut, but I'm just saying when people have a bowel and intestinal movement system that's regular, not bloated, not gassy, not diarrhea, not constipation, they feel good. And when it's disordered, especially people with irritable bowel where they have a loose stool, that's when every store you walk into, the first thing you're looking for is a bathroom because you don't know when you're going to get the call. And there's this big correlation, obviously, to irritable bowel and low serotonin being produced in the gut. This gut immune brain connection you can't avoid. And so when you look at this, the brain is, of course, the command center, cognition, memory, mood, and emotion, central figure of physiology. And the immune system, it's innate and acquired immunity. It's the repair cycle, right? How my immune system is helping me to repair. And I'm going to get to that in just a second. And then the gut's the single epithelial barrier where initial metabolism and transformation of biochemicals occur, and it's a structural defense. And by the way, when your gut gets leaky, your brain gets leaky. When your gut's leaky and your brain's leaky, usually the endothelium's leaky. You're damaging the glycocalyx. So it's the three major interfaces of the body that are one cell layer thick that are being driven to dysfunction when we're under chronic inflammation. And when the gut is permeable, there's more chronic inflammation. And of course, these are just some things that you see with pathology. Abnormal cortisols, elevated beta 2 microglobulin is an evidence of a leaky blood brain barrier, melanocyte stimulating hormone being lowered, depressed neurotransmitters. Maybe you have a gene SNP that's not allowing you for methylation and allowing to make those neurotransmitters. Of course, from the immune side, it's elevated C-reactive protein, eosinophils, IL-6, TNF-alpha, TGF-beta, VEGF, C4a, C3a, food allergies and sensitivities, measurable toxins, viruses, and of course with the gut, histamine, VEGF, obviously a CBC differential, right? Monocytes, eosinophils, and basophils. great ways to think about this. And you can never escape this reactivity. So whenever I'm doing, and I've got a final slide where I walk you through what to do. But if somebody's upset all the time, they're nervous, they're anxious, they're a worrier, good luck fixing their gut because they will forever be sending sympathetic tone through the vagus nerve and affecting the enteric muscle, affecting the enteric nervous system, creating a permeable gut via IL-6 activation and Claudin 2 activation of the epithelial cell, which breaks the tight junctions, which then increases more inflammatory cytokines that get into the bloodstream. And then, of course, cortisol also getting into the bloodstream, leading to it, which I've got a slide to show you that as well. So you can never get away from this. For me, whenever I'm working on a gut, I need to know that the person's sleeping well. I need to know that they're not feeling overcommitted during the day, that they're not anxious and nervous during the day. They're not worrying, perseverating, making lists, and are not having food cravings that are related to stress. If they have any of those categories, I need to correct for that while I'm working on their gut. Otherwise, all you'll be doing is rotating your foods forever. And you'll still be progressing towards autoimmunity, cardiometabolic issues, neurodegenerative disorders, and mood disorders. And you guys have seen a million of these. I just wanted it to depict that when the gut gets leaky, you get bacterial translocation, you get peptides that get through that now the you get macrophage activation, you get antigen presenting cell activity that trigger this inflammatory cascade systemically in the body. And that's why people ache and they have joint hurts and their brain gets foggy and their eyes get red and they feel dopey and they get gassy and bloated and all these things that we see. And look, here's a picture of it. I just put this in here for a picture, right? Healthy gut on the left, broken gut on the right, right? This is human, right? This is electron microscopy here. Here are the cracks. Back when I wrote Cracking the Metabolic Code, which edition 2 is coming out this year with all the latest innovations, I talked about permeable guts and leaky guts, and people laughed. They're like, ah, yeah, leaky guts, holes in your gut. Turns out that's what it was. We just didn't have the ability to look at it back then, and now we do. And so you see that we get these cracks in the epithelial tissue. We get this breaking of the brush border. See how nice and tight the brush border is on the left, and see how broken it is on the right? That's going to create compromised absorption of nutrients and compromised protection against pathogens and allowing peptides or proteins in too fast. So this is just in this particular study, this was talking about inflammatory bowel disease and colorectal cancer, a common ground hypothesis, right? And then what are all the things that people with food allergies suffer from? Guys, look, it's everything. Of course, it's everything. Because when you have food sensitivities and allergies, you are driving lipopolysaccharide and other inflammatory compounds to be released systemically, which is now affecting other tissues. And depending on your genetic and epigenetic experience of all the other issues that you've been dealt with through your life, you're going to express a problem somewhere, whether it's in the blood vessels or the brain or your beta cells for your insulin regulation or your mood, right? Something's going to happen. And this is when we talked about modulation of the immune system, why are food allergens important and sensitivities? I'm going to take questions at the end. So please, otherwise I won't get through my slides and I'll answer questions quickly. So if you note this particular graphic, we get a stimulus that triggers inflammation and our body's supposed to turn on inflammation to eliminate the inflammation cause. And then it turns it off and we end up back in homeostasis. So my point of talking about food allergens and sensitivities is hey, we're going to work on getting you to release more growth hormone and we're going to work on getting your insulin receptor to work better. We're going to give you GLP-1s, which great drugs, by the way, if used appropriately. But if we don't stop the chronic lighting of the flame, which is I'm reacting to a food. I'm reacting to a food. Oh, I just can't avoid gluten. I love gluten too much. You're still going to drop down this funnel, which leads to bad actor lipids, right? So you see the bad actor lipids over on the left. Sarcopenia, start to lose muscle because you'd shut down your growth hormone. You create dynamic muscle perfusion loss. You get ischemic. You start seeing alterations in iron and ferritin. So your iron is normal, your ferritin is low because of the increased metabolic inflammation that leads to hepcidin upregulation. Now, it progresses to insulin resistance. Now you'll see a transition to high ferritin. So they coexist. So the further you go down, if insulin resistance is involved, you'll see higher ferritin. But if you don't have insulin resistance, but you have metabolic inflammation, you may just see high iron and low ferritin. But you're seeing more of that now. I know you are because I'm seeing it all the time now. And we're doing a project with Lifetime, 2.5 million members. We're doing testing for longevity and performance health, and we're seeing this kind of stuff. Bone loss, changes in neurogenesis, right? Loss of cell plasticity, loss of neurogenic growth factors. And then, of course, the net is I become more and more meta-inflamed. I'm damaging my mitochondria. I'm reducing adiponectin. I'm losing the signaling of PGC1 alpha so that I don't have mitochondrial vigilance in my cell. So this is why for me, food is ground zero, guys. Like I said, people eat food every day. And if they're eating food every day and they're allergic and they're reacting and they have sensitivities, they're reacting IgG4, they've got C3BD, IgE, or even high IgGs, they're going to continue to feed the red side of this process. And just keep in mind, pro and anti-inflammatory regulation is what's important. And that's right. Glucocorticoids, insulin, and the growth factors can trigger. So how much that's going on can create this triggering of more interleukins. And once again, going back to it's all connected, the gut-brain axis. We've been talking about gut immune brain. If you look over here, mucosal immunity. So here's the breakdown of the gut lining and the more food sensitivity and reactions, environmental burden. Maybe you've got infection or biotoxin exposure. Maybe sleep quality's poor, diet's off, genetics all affecting it. But all of this leading 1 to neurodegeneration, 2 to mitochondrial dysfunction, 3 to abnormal protein utilization. And then you get, because of this disruption, the gut triggering more lipopolysaccharide, more inflammatory chemistry, more lipid metabolism issues. And then, of course, the heart pumping oxygen and nutrients towards the digestive tract to keep that microbiome nourished. When people have heart failure, they reduce blood flow to the heart. Guess what happens? They make more lipopolysaccharide. And lipopolysaccharide is what's indicated in multi-organ heart failure. So if you're not figuring out how people need to eat, you're missing the boat on further heart disease. So when we think of, I know my title was about immunity. Guess what? Heart disease is an inflammatory process. And then we go to this. So the GI tract, the gut barrier breaks down. You're reacting to foods, infections, poor diet, stress, microbiota dysbiosis, excessive physical activity, not just not enough activity, excess triggers it. And then we increase zonulin. Zonulin increases. We lose the gut-brain barrier. We lose the blood-brain barrier, which now releases inflammatory cytokines, and lipopolysaccharide crosses the blood-brain barrier to activate the microglia. That leads to neurotransmitter metabolism problems, more canurinic acid, quinolinic acid, more beta-carboline, more cell-solanol, less serotonin, less dopamine, less GABA. And now we lose neurogenesis and we induce glutamate excitotoxicity. So my argument is that when the gut immune interface is disrupted, it virtually can be at least a partial co-conspirator in most of the conditions that we deal with today. Same thing with chronic stress. I'm not going to go through this too quickly because I want to save time for questions, but the bottom line is that chronic stress alters gut mobility, visceral sensitivity. When you're stressed out, your gut gets dysbiotic. That's why when I said, if you're not dealing with, I'm not getting enough sleep, I'm anxious during the day, I'm nervous and overcommitted, I can't seem to keep my act together, I'm going through a divorce. If you can't calm them down through breathing exercises, giving them some certain nutrients, I listed them at the end, and then dealing with their gut and working on their gut and getting rid of their foods, you're not going to get the job done. You got to work at this together. Okay. And this is out of International Journal of Molecular Science, 2020. Why measure heart rate variability? And by the way, these guys aren't the best on heart rate variability. I actually have been using a Morpheus strap, which is way more efficient. So don't rely on this for your HRV. I've been testing different devices. Great for heart rate, actually pretty accurate, and great for telling you it's time to breathe. Thank goodness we know it's time to breathe. Because when you don't breathe, of course, you build up lactic acid, you do shallow breathing, you induce sympathetic tone. So this is that whole aspect of the brain, the autonomic nervous system, signaling the gut, signaling the immune function, altering endocrine pathways and neural pathways, leading to dysfunctional signaling to the brain. Now, let's face it, we got a lot of people complaining about disturbed memory. And once again, that you guys have, if you've seen me talk, I've used this a million times, but the net of this is stress of any kind leads to HPA axis activation. The direct effect is increasing cortisol, which then increases permeability in the gut. But the secondary effect is spinal cord activation of adrenaline and noradrenaline, which triggers the enterochromaffin cells and nerve fibers, which lead to peripheral corticotropin releasing hormone upregulation, which has a direct effect on mast cells, leukotrienes. And so you end up with a more permeable gut, more inflammatory signaling, more antigen presentation. The gut's breaking down, and now that feeds into the vicious cycle, creating more stress. That's why work the brain, work the gut. Super important if you're trying to actually get somewhere with their gut. This is a flattened cortisol curve. Once again, we see all these studies, I just threw them in here, about a flat cortisol curve leading to HPA axis dysfunction, which leads obviously to coronary artery calcification. So the flattest cortisol curve leads to calcification. Why? Because when you flatten your cortisol curve, that's when you've created so much immune activity, you've created more lipopolysaccharide exposure, and your gut is now, compromised. Another study, same thing. Flatten cortisol curve, increased cardiovascular mortality, elevate PM cortisol, independent predictor of subsequent cardiovascular mortality. Why? Because when cortisol's up, I make more IL-6, more Claudin-2, permeable gut, more lipopolysaccharide, more immune reactivity, more food sensitivities that trigger a background of low inflammatory fire. And here it is, metaflammation and chronic heart disease. Increased CRP directly interferes with nitric oxide formation. So CRP has been correlated to food allergies and sensitivities, and it creates endothelial dysfunction, alters the way the heart fires, impairs the efficiency of gap junction mechanisms, right? So it leads to dysregulated electrical conduction. So people have heart attacks with autonomic nervous system dysfunction. It's not just lipids. And that autonomic nervous dysfunction can be tied to the enteric nervous system. And metaflammation, this is the whole aspect of Klotho. So if you're familiar with Klotho, that Klotho is this basically peptide that is helping to regulate inflammatory signaling in the cell. Not the only thing, but an important one. And that a deficiency in Klotho leads to an easier movement towards NF-kappa B, lipoxides, C-reactive protein, and such. And of course, with inflammation comes brain volume changes. These are just studies that show that. Here's the two study on the intensity of exercise, International Journal of Environmental Research and Public Health. The harder and longer you train, the more you lose microbiome diversity, the more you lose intestinal integrity, you have increased permeability. That's why people get runner's diarrhea. That's why we see people get reactive airways when they train really hard, because they break their gut down and now they're reacting to peptides and they're getting bacterial translocation and all kinds of issues. They create more markers of inflammation. Their zonulin goes up, their CRP goes up, and they get negative changes in their bowel. So yes, the harder you train, the more you have to work at creating a healthy gut. I'm not saying don't. Okay, so where are we at here? So let's keep going. All right. So, and this brings in the effect when I talked about lipopolysaccharide, how important it is. When the gut is breaking down and you're making lipopolysaccharide, it activates toll receptor 4, which activates on microglia, which is going to affect the brain, but then it also increases IL-6 and TNF alpha and IL-1 beta, which creates insulin resistance. We know that insulin resistance is driven by inflammatory responses. And part of it is because it's coming from the gut. A big part of it's from lipopolysaccharide. And of course, that lipopolysaccharide also triggers damage to the beta cells and also activates macrophages in the visceral adipose tissue that triggers low-grade inflammation. So you make more resistin, more angiotensinogen, you downregulate adiponectin, and adiponectin, of course, is the major antioxidant in your body that's protecting those insulin receptors as well as a variety of other tissues. If you're not familiar with adiponectin, you should get there. And then, of course, lipopolysaccharide, here's what all the places that it affects your body, right? If you're not deeply embedded in understanding lipopolysaccharide, you've got to get there because this is the biggest damaging inflammatory compound that you can release. And then, of course, even as it relates to thyroid. So the gut microbiome influences the thyroid because one, microelement uptake, and of course, so does stress, right? Cortisol reduces T4 to T3 conversion. You create more T3. If you're low in iodine, if you're low in chromium, if you're low in iron, these trace nutrients are needed, and ferritin, right? So if you have metaflammation, you have low ferritin, there's no way to get T3 to penetrate the cell membrane. And then if you look here, activation of toll receptor 4 by LPS downregulates pituitary and thyroid function, and it enhances thyroglobulin synthesis and exocytosis into the follicular lumen, and then also suppresses thyroglobulin resorption. So, so LPS drives one of the big drivers of Hashimoto's food antigen induced thyroiditis, because as the lipopolysaccharide proliferates, it hits it. And this is just a slide that's just showing you, this is Frontiers in Endocrinology 2022, telling us that lipopolysaccharide is a big factor on affecting the follicles of the thyroid and driving thyroid peroxidase and driving thyroglobulin antibodies. And then, of course, there's zonulin. I already led with zonulin, but just basically, when you get under any kind of metabolic duress and zonulin upregulates, you're going to break your tight junctions. And that could be due to a pathogen or it could be due to stress. And the last piece is, of course, is that here are all the conditions that are associated with high zonulin. And I've seen gliomas in gluten, literally celiac patients that develop gliomas because their zonulin levels are so high. And obviously, all these other conditions that are present. The gut is driving a lot of this. But remember, it's always the gut in relationship to the rest of the body. What is going on that's driving the gut dysfunction? I had to bring up histamine quickly because it's so important. Remember, when you're making histamine, it's not just about a sneeze or itchy eyes or asthma. It's headaches, it's migraines, it's insomnia, it's anxiety. It could be for women, it could be period cramps and period dysregulation, missed periods, endometriosis, estrogen dominance, muscle and joint pain. If you look at this, there's a lot of symptoms that we don't attribute to histamine because people weren't itchy, but it could still be histaminic. All right. And this is just to show you how histamine gets metabolized. And if you look down at the bottom, you need aldehyde dehydrogenase to break down histamine. And if you're making a lot of acetaldehyde from all that Candida, you're not going to get that happening. And then I just made this for you quickly. Approaching gut repair. First, it's assess food allergies and sensitivity to eliminate offending foods. Get the foods out so that you can decrease some of the ground state inflammation that's going on with the foods they're eating every day. Assess if stress is a component. You do a 4-point salivary cortisol, a serum morning cortisol. You can do a 5-point urinary cortisol. I don't care. Just assess it or just ask them. Are you overcommitted? Are you anxious? Are you craving foods? Do you mow through a bag of salty chips? There's no tomorrow and lick the salt out of it. These are signs that it's a problem. You're having trouble with sleep. Do you have insomnia? You're waking up in the middle of the night. I use Quicalm. Obviously, I'm prone to it. I designed it. It's Relora-theanine and holy basil. You could just use Relora. If you're going to use theanine, that's when it's for perseveration. I can't stop thinking about the day's events. You could use holy basil. You could use certain ashwagandhas if you want something to dampen their stress. And then you've got to repair the gut. So use the brain, repair the gut. I don't care whether you use, I love cat's claw because it's anti-inflammatory effect. I love berberine because it lowers zonulin. You could use grapefruit seed extract. Make sure they're taking fiber. They need probiotics. I'm not going to tell you there's any one probiotic better than others. Of course, everybody needs Akkermansia now and nothing else. That's the joke. Akkermansia is great, but it's not the only probiotic your body needs. And then also think about what peptide you could give. Lorazepam and KPV. Lorazepam lowers zonulin, KPV decreases TNF alpha. You can think of BPC as a liposomal tablet. We developed that technology to deliver that. Chew that up one twice a day. That really helps as a gut repair. And then the classical nutrients that are there. I just left this. I'll make this presentation available for folks. Please honor copyrights on it, but I'm more than happy to make it available for all of you.
Welcome to Root the Health, the best place to order, manage, and track results from over 30 different lab companies in one single place for free. It's going to take you under 2 minutes to sign up, and you can order any functional medicine lab for your client in under 30 seconds. Let me show you how it's done. So here's our beautiful interface. I'm typing in the name of my client, selecting the lab that I want to order for them, and hitting send. From there, Rupa and their amazing team handle the rest. They email the client, collect payment, and even offer an interest-free 3-month payment plan. We've also built the world's largest library of information about chronic health conditions, the lab tests that can help you find the root cause, and the evidence-based interventions that you can use to help people heal from them. It's called the Rupa Health Magazine. There, we have in-depth articles about almost any health condition you can imagine. And we give you step-by-step protocols that other clinicians have used to help their clients heal and that are verified by evidence-based sources. You should totally check it out, and it'll transform your practice. And we can't wait to see you. So make sure you sign up today at rupahealth.com.